Hey everybody, my name is Dr. Blake Olson. I'm an orthopedic surgeon with Sports Medicine Orthopedic Centers, and I'm continuing my discussion on regenerative medicine. In this next series of short videos, I'd like to talk about shockwave therapy. Shockwave therapy is used frequently in our practice. We've had a substantial amount of success for a variety of orthopedic problems, and so I'd like to address the most common questions we have regarding its use. That includes an explanation of what exactly shockwave therapy is, what are the most common conditions that we consider the use of shockwave therapy, and when a person should consider shockwave therapy for addressing a particular orthopedic problem. So what is shockwave? Well, that's a very broad question. I'll try and make this answer as simple as possible. The use of shockwave is, as the name implies, using a force that's transmitted into a tissue. There are different types of shockwave. Some of them penetrate deeper than others. Some of them cover a broader surface area than others. The way in which they transmit energy can vary. But the bottom line is that use of shockwave is to transmit energy into a tissue. So where did shockwave originate? So this is the earliest application of shockwave. This is a slide that I borrowed from a talk that I recently attended. As you can see, the shockwave device on the right takes up nearly the whole room and is used to transmit sound energy through the body to break up kidney stones. As you can see here, the use of shockwave doesn't damage any of the tissues in its path, but it does have the ability to break up kidney stones. This was developed in the 1980s. It's known as lithotripsy, and later was adapted for orthopedic use in the 1990s. So shockwave initially was derived from the treatment of kidney stones and later became available for orthopedic applications in the 1990s. Those machines were initially fairly cumbersome. Over the past few years, however, the technology's improved, and now there are tabletop units that are available. Now, there are a few important differences between the different types of shockwave available. That one in particular was used for lithotripsy, was electromagnetic shockwave. So this is what we use in our clinic. This is called focus shockwave. This particular device uses electromagnetic technology to generate a shockwave. This device in particular is the one that was derived from lithotripsy, or breaking up kidney stones. We find it has several advantages. It allows us to treat varying depths of problems. So we have something that's more superficial, we can treat it using a series of offsets. Or if we need to treat something that's very deep in the body, we can get as deep as 12 centimeters, although often we don't have to go that deep. In addition, it has an energy source that can be varied, so it allows us to use a variety of different both frequencies for the number of shocks that are delivered, in addition to the amount of energy can be varied as well depending on the problem we're treating. So this is another type of shockwave. This is called radial pulse shockwave, or otherwise known as EPAT. I've used this device before. It's less expensive. It works very differently. It's not considered a true shockwave. In this instance, it uses an air compressor to fire a projectile against a transmitter. Depending on the applicator tip, it can be used to stimulate tissues beneath the applicator tip. Its advantages include that it's less expensive and can cover a broader surface area. The disadvantage compared to traditional focus shockwave is that focus shockwave is able to get substantially deeper and is able to generate a substantial greater amount of energy. That allows us to expand the use of shockwave into the treatment of conditions involving the bone, which radial pulse shockwave simply is unable to reach. So as I was alluding to, there are a number of forms of shockwave that are available. True shockwaves are generated through piezoelectric technology, electrohydraulic, or electromagnetic technology. We use electromagnetic in our practice. There is this other type, as I was saying before, called radial pulse, which is not a true shockwave. Not to say that it's not useful. It actually uses an air compressor to fire a projectile against a transmitter and generate energy, which is then transmitted to a tissue. So the advantage to radial pulse technology is that it covers a broader surface area and it is less expensive. However, for the purposes of our practice, we treat a wide variety of conditions. We treat tennis elbow, we treat Achilles problems, and also a number of bone issues as orthopedic surgeons. So it's important for us to have a device that had the ability to treat very superficial level and also to penetrate very deeply, whether it's hamstring or whether it's into a bone. And focused shockwave is able to do that, whereas radial pulse is not. So I appreciate everyone taking the time to join me on this brief introduction to what exactly shockwave is. Through the next series of videos, I'll be going through some of the most common questions we get regarding shockwave technology. When is it appropriate to consider, and what are the most common uses for shockwave treatment? I think like any of these regenerative technologies I talk about, I'll say again, I think the importance is having a provider that has a comprehensive knowledge of both the traditional conservative methods that are available and also the surgical options and everything in between. And that also applies to any of these regenerative techniques, including shockwave. Thanks again. If you are interested in any more information, please head over to our website at smocse.com. Thanks.